Good evening, everyone. I'm Kruti Joshi from Family 6th year, and today I'm going to present a case on endometrial polyp. So, there's a 48-year-old female patient who came with the complaints of intermenstrual bleeding since 2 months. Episodes of bleeding occur anytime in the cycle. Fresh red blood lighter than a normal period, no associated pain, no hot flushes or night sweats, sexually active, and no vaginal dryness. So, what is intermenstrual bleeding? It is also called as vaginal bleeding. Vaginal bleeding at any time during the menstrual cycle other than during menstruation is known as intermenstrual bleeding. There are different causes of intermenstrual bleeding, which is physiological cause and pathological cause. Physiological cause includes hormonal fluctuation or the one which occurs prior to menopause and in early pregnancy. Pathological cause includes infection of vagina and cervix, trauma to vagina, and can also cause intermenstrual spotting. The other different causes includes cancer or precancer, uterine fibroids or uterine polyps, changes in hormonal levels such as progesterone and estrogen, inflammation or infection of cervix, injury or disease of the vaginal opening, which can be caused by an intercourse trauma or infection, intrauterine device use, ectopic pregnancy are when the fertilized eggs implants out of uterus. It is very rare. Miscarriage and other pregnancy complication, vaginal dryness due to lack of estrogen after menopause, stress, using hormonal birth control pills, or use of any anticoagulants. uh, Other symptoms which may include are pain, fatigue, fever, and dizziness. And there are several different diagnostic tests to diagnose this, which includes pelvic exam, biopsy, ultrasonography, hydrosonography. So the family history had she had three children. Medication history: she used progesterone pill for contraception for 5 years. Examination, speculum examination, slightly atrophic looking vagina and cervix, but there are no apparent cervical lesions and there is no current bleeding. By manual examination, uterus is non-tender and of normal size, axial and mobile. There are no adrenal masses. Transvaginal ultrasound and hydrosonography. Now, bimanual examination is also called pelvic examination. It is used for examination for female genital. The provider inserts two fingers into the vagina and then places pressure from the other hand to lower the belly, and the vagina and cervix is examined. The lab investigation: hemoglobin 12.7 gram per deciliter, white cell count 4.5 into 10 raised to 9 per liter, platelets 401 into 10 raised to 9 per liter. A differential diagnosis for intermenstrual bleeding are cervical malignancy, cervical ectropion, endocervical polyp, atrophic vaginitis, pregnancy, and irregular bleeding related to contraceptive pill. The final diagnosis for this case is endometrial polyp. The diagnosis is of an endometrial polyp. These can occur in women of any age, although they are more common in older women and may be asymptomatic or cause irregular bleeding or discharge. The etiology is uncertain and vast majority are benign. It is the specific case or all the differential diagnoses are effectively excluded by history and examination. Endometrial polyp is an overgrowth of endometrial tissue that projects in the uterine cavity. Basically, it is a non cancerous growth which is attached to the inner wall of the uterus. It forms when there is an overgrowth of endometrial tissues. The causes of it can be if you're overweight or you have high blood pressure or hormonal replacement therapy. Other symptoms includes abdominal bleeding, which is called as intermenstrual bleeding, vaginal bleeding, which occurs after menopause, and irregular menstrual periods. Unusually heavy flow during menstrual periods, bleeding or spotting between periods, infertility, which is unable to become pregnant, vaginal spotting or bleeding after menopause, and bleeding after intercourse. These are some symptoms of endometrial polyp. uh, Estrogen plays an important role in endometrium. Estrogen plays a role in causing the endometrium to thicken each month during the menstrual cycle. For this, there are many diagnoses such as pelvic examination called the bimanual examination, the speculum examination. The speculum examination is a device which is used for looking into the cervix and vagina. Now, endometrial polyp are of two types, which can be completely asymptomatic and symptomatic. The symptomatic one can cause abnormal uterine bleeding, heavy menstrual bleeding, intermenstrual bleeding, and postmenopausal bleeding. Endometrium polyps can be single or multiple. The exact cause of it is not known, and it is associated with endometrial hyperplasia. The risk factors includes use of tamoxifen, which is a cancer drug used for breast cancer, obesity, late menopause, and hormonal replacement therapy. Other diagnosis includes transvaginal ultrasound, hysteroscopy, and saline infusion. Now, for the management, any woman should be investigated if bleeding occurs between periods. In women over the age of 40 years, serious pathology, in particular endometrial carcinoma, should be excluded. The polyps need to be removed for two reasons: to eliminate the cause of bleeding and to obtain a histological report to ensure that it is not malignant. Most of the it are not malignant. It would be a very rare case when it is a cancerous form. Now, management includes different diagnostic tests such as hysteroscopy. Now, hysteroscopy is the exam of inside of cervix, and it is done when anesthesia is administered and the cervix is dilated. Then there is a hysteroscope is inserted through a vagina and cervix and into the uterus. It is a tube-like form, and a liquid or gas expands your uterus. And then a light on the hysteroscope allows the physician to see your uterine cavity. It is used to investigate symptoms such as heavy periods, unusual vaginal bleeding, pelvic pain, or postmenopausal bleeding. Dilation and curettage, which is known as DNC, it is a procedure to remove tissue from your uterus. The cervix is dilated, so the uterine lining can be scraped with the curette. Curettage is a spoon-shaped instrument which is used to remove the abnormal tissue in your uterus. Thank you.